Meantime, as shortages of popular weight loss drugs drag on, one telehealth company is out with a new tool to help patients access their doses. Ro's GLP-1 supply tracker launched last week. It's a free site allowing anyone to find supply information by drug, dose, size, and pharmacy location in real time. Patients also set up alerts to find out when doses become available in their area. Joining us for more is Zach Reitano, co-founder and CEO of Ro. Zach, welcome to Fast Money.
Thanks so much for having me.
So how is this powered? Is this crowdsourced?
It is crowdsourced. So the tool does, we're super excited about it, does two very specific things. The first is that it lets patients crowdsource supply by sharing where they found it, and it'll notify any patient who said they need supply within 100 miles in real time. Second thing it does is it lets patients report shortages to the FDA in 30 seconds or less. And so we released it a week ago. In the last week, we've had over 25,000 submissions of shortages. We've had well over 1,000 people report supplies. We've been able to notify patients across the country to increase access to these drugs and help navigate the shortages.
So is this only reporting shortages of actual name brand GLP-1 drugs?
That's right. Patients will report the drug, dose, that they need in the zip code, and then patients will report the pharmacy that they found that drug in, and we will notify a patient with the pharmacy name, link, phone number to be able to transfer to that pharmacy.
In theory, does this help the FDA keep track of how deep the shortage is and therefore keep tirzepatide and semaglutide on the shortage list so that they can be compounded?
I think the main intention with this, and we've been in touch with the agency, and they've been very receptive to sharing information in real time, because their main goal is just that what the patients experience in real time on the ground mirrors their list. And so that is what they've been concerned about, both by talking to manufacturers, by talking to companies like Ro. And so the more real-time data we can give them, the better off that they are.
Lilly and Novo, clearly, but there are differences in terms of how they deal with their supply issues.
Yeah.
Can you speak to that?
Absolutely. I think that what you see is the way that they're dealing with the shortage is pretty representative of the strategies, too. So, I mean, what they're doing similarly is they're both investing tremendously in ramping up the supply chain. But in terms of differently what they're doing, you see Novo, it's choking early titration doses. So it's harder to start, but easier to maintain for people on the higher doses, which is essential to see those results. Lilly, you see it's easier to start, so 2.5 and 5 are available, but the higher doses aren't. So it's easier to start, but harder to continue. And so you do see that. You also see Lilly actually getting approved single-dose vials, which will hopefully increase supply, but they are taking different strategies here.
Yeah, talk to us a little bit. Obviously, these were diabetes drugs, and they moved into obesity. And you guys have spent a lot of time kind of demystifying or destigmatizing the obesity aspect of it. Like, how are you guys thinking about this? And we are reporting, I guess, every day on, like, different potential use cases. What are you most excited, I guess, away from obesity and obviously diabetes?
Well, I think they aren't, to your point, they aren't just X drugs. They're not just diabetes drugs. They're not just obesity drugs or cardiovascular disease or kidney disease or sleep apnea. They're being studied for depression and addiction and Alzheimer's. So they aren't just X drugs. I think the really fascinating thing is we've been looking for a place or a universal wedge for consumer healthcare for a long time. And I think what you will see is GLP-1s really serve as the sun around which all other care will orbit because of their broad efficacy and the breadth of the label. But the stigma, to your point, the real impact that the stigma has is on those less fortunate, because that impacts perception, which will impact employer coverage, government coverage, payer coverage, whereas those with means, they are sort of unperturbed by the stigma and they'll pay for it.
Hims and Hers, huge pop the other day on news that it's going to offer compounded GLP-1s through their site.
Yeah.
You got to be thinking about going public.
Biggest thing for us
is an investor, right? Rick is on all the time.
Rick's an investor.
GLP-1 adjacent, I mean, just like AI adjacent gets huge multiples. So GLP-1 adjacent should, in theory, too.
Right now, solely obsessed with helping our patients navigate the shortage, providing as many options as possible. And I think, there will be a time, but right now it's just helping our patients navigate this.